From the hidden dangers lurking beneath the sand to the sharp rocks and seashells, being barefoot at the beach can sometimes lead to unexpected accidents. Today we'll be diving into a common beach incident that can turn your dream holiday into a totally painful nightmare. At the end of the procedure, I also discuss post-operative care, how to look for infection, and how to prevent this injury. Have you ever been enjoying a perfect beach holiday only to stub your toe on a hidden rock? Unfortunately, this can lead to serious injuries, just like the one we're going to be covering in this video. Hello, I'm Stephen Thomas. I'm a podiatrist, which is a foot and ankle specialist, and I'm based in the Harley Street Medical District of Central London. Just before we get going, I make free videos to help as many people around the world as possible with foot and ankle healthcare. If you'd like to help me with my mission, please like the video, share the video, and pop any comments or questions you have down below. So let's get to the video. This lovely lady was enjoying her holiday until she stubbed her toe on a rock, causing the nail to lift up and separate from the nail bed. Of course, it was extremely painful and bled at the time, and then she managed to see me within a couple of days, as it happened at the end of her holiday, and was able to see me soon as she arrived back in London. Join me as we go through the step-by-step procedure in removing the damaged toenail and explaining why it's necessary, and sharing some tips on how you can prevent these sort of injuries happening to you. Here's the toe. It has already been cleaned, and the 2 red dots are from where the local anaesthetic injections have gone. We're just waiting for it to go numb. Trauma to the tip of the toe creates these sorts of injuries, and there's a higher risk if your nail is long. At the beach, this can easily be done by stubbing your toe on a rock that's hidden in the sand. At home, I find people cause these same sort of injuries by stubbing their toe on the doorway or furniture. It's also easily done during a sporting collision. Here, we are just testing the toe to see if it's numb before we try removing the nail. Feel that, right? So now you can just relax. This blue ring is a tourniquet. It's rolled over the toe to stop any bleeding during the procedure. This tool is a nail elevator. We're just inspecting underneath the nail and then making sure that the nail is fully separated from the nail bed before removing. Now, the nail is ready to be removed using the forceps. You can see there's some sand and shingle underneath the nail, so this needs to be cleaned out. We will do this by flushing it with saline solution, which is effectively sterile salty water, and then wiping it with sterile gauze. Yeah, I think that's the sand. So let's flush it out. Just bring it to your ears. Yeah, a bit of gauze. There you go, cleaning it all up for you. So, looks amazing. Way better already, doesn't it? Just bring your foot this way. Now that the nail and shingle has been removed and wound cleaned with saline, the tourniquet can be removed. As the blood returns to the toe, you'll see it become pinker in colour. With a sprinkle of luck, there was no bleeding following the procedure. Hey, it's not bleeding much, huh? The toe was dressed with Gelonette, gauze, Tubinette and Micropore. 30 centimeters. So when the anaesthetic wears off, it's probably going to be a bit sore. But it's been sore for a while now, so. Keep watching if you want to learn about post-operative care, how to look for an infection, and how to prevent this type of injury. No, it becomes shorter when you put it on. It stretches out. So maybe that's really yeah, it gets shorter when you stretch it. So yeah, and we got some Micropore as well. There you go. You did amazingly well. You did amazingly well. Press it there. That's good. Let me get it. I know. I know. Show up. Because of the injury. There you go. Amazing. The typical type of aftercare for these types of injuries usually involve bathing the toe in a bowl of warm salty water for about 5 minutes and changing the dressing every day until it's completely dry and healed. One of the things to manage with these types of injuries is sensitivity. The skin under the nail never gets touched because there's always a nail stuck to it. So therefore, when the nail is removed, it can be incredibly sensitive underneath. This can be managed by using a dressing regularly until the skin sensitivity reduces. These types of injuries will need to be monitored, so I usually get my patient back about a week later just to check that it's all healed up and it's looking very nice and there's no signs of infection. We'll also need to monitor the nail regrowth. The regrowth may take sort of about 9 months, and we want to make sure that there's nothing there hindering its progress. Infections are common from these types of injuries as they bleed, there's some trauma, and there's of course some sand and some rocks that can get into the wound. The signs of infection usually take a few days to develop, and the signs that you should look out for are swelling, pain, redness, pus, and a bad smell. The difficulty in identifying infection can be quite tricky with these sorts of injuries because with the trauma you'd expect some swelling, some redness and some pain. This is why you should see your local podiatrist, and of course don't try to do this sort of procedure yourself at home. One of the ways to avoid these types of injuries is by keeping your toenails short. A long nail overhangs the toe, so if you stub the toe, the nail's going to take all the trauma. So keeping this short and filed will help. Wearing beach shoes can also help, so it might be worth investing in a pair of these. Particularly if you're going to be carrying out sport on the beach, it might be worth having a quick recon of the area, check the beach, make sure there's no hidden rocks in the sand before you start playing a game of football. And finally, of course, if you're on holiday enjoying yourself, try to limit your consumption of alcohol. Alcohol can increase the risk of you having these sorts of accidents as well. I hope you found that video useful. If you did, please give the video a thumbs up, share the video with anyone you think it may help, and pop any comments or questions down in the comments below and I'll get back to you. Thanks very much, and I will see you soon.